All right, we'll call the meeting to order. It is 5:31, and we'll start with the Madam Vice President giving us our land acknowledgement.
Buenos dias to the Tlingit, Haida, and Tsimshian people. We respectfully acknowledge them as the original inhabitants of Southeast Alaska. Bartlett Regional Hospital is located on the homelands of the Occoquan. We are grateful to provide services in your ancestral homeland and to be a part of this community.
Thank you, Deb. Can you note the roll? I think we got everybody in the room is here.
Yep, everybody's here and
Annette. Can you get approval of the agenda, Madam Vice President?
I move to approve the agenda as presented.
Thank you very much. And Deb has told me that she has a engagement today at about 7:15, 7:20. She's going to have to sneak out of here and go to the assembly and testify concerning the flood. So we'll let her go then too. So we'll move the meeting along really quickly. Yeah. Okay. Public participation. Do we have anybody here for public participation? Mr. Warden. Please go. Okay, thank you.
All right, thank you. My name is Ian Warden, and I spent the last year as the interim CEO of Bartlett Regional Hospital. It has been my honor and privilege to serve in that capacity. This past year has been challenging to become sustainable while refocusing on Bartlett's mission for medical activities. Accordingly, the leadership team, the board, city officials, and I have grappled with very difficult decisions, especially around non-core activities. These are defined as activities not normally found in hospitals. Our focus has always been on the delivery of high-quality patient care. Decisions were not made lightly or quickly, but deliberately, thoughtfully, and in collaboration with other key groups, including city officials, the assembly, the community, and other local providers. In all of our discussions, I have found these groups to be highly professional, collaborative, offering practical solutions and advice, and willing to fill the gaps in care that Bartlett can no longer support. I want to thank the board for their thoughtfulness and due diligence when making decisions in the best interest of the community. They had to balance needs and sustainability. They always encouraged leadership to seek alternative ways and providers to ensure care is continued within the community at sustainable levels. My special thanks to Kenny Solomon Gross as the president of the board for his dedication to Bartlett and his advice and counsel to me. Deb Johnston, vice president, and Max Mertens, finance committee chair, were always available and generous in their assistance. I'd always also like to thank the other board members, including Lisa, Shelley, Hal, Dr. Jones, and Dr. Raster for their support. The Bartlett leadership team is excellent. I want to thank Joe Warner, our new CEO, Kim McDowell, our COO, CNO, and Gil Moorhead, Chief Quality and Compliance Officer. Bartlett is lucky to have such a hardworking, dedicated team. I have complete confidence in that team to lead Bartlett forward. I would be remiss if I did not thank Doctors Nat Malter and Rosenfeld, the current and past chiefs of the staff. I thank them for placing their confidence in me to work on issues important to the medical staff. Finally, Bartlett Regional Hospital is a gem. It's a gem because of the dedicated and highly trained physicians, nurses, clinical professionals, and staff. Without their efforts every day to provide quality care, Bartlett would not be the same. I am grateful to be part of such a wonderful group of people making Bartlett's mission a reality. Thank you, Ian.
Thank you, Mr. Warden. So I just want to personally say thank you very much for your counsel and advice during this past year. It has been an exciting new time, but a very trying time for us. And you were always there for me whenever we had public comment or questions or anything. And your vast knowledge of healthcare has just been amazing. I want to thank you. I want to thank your family, your lovely wife, who allowed us to borrow you for the past year to come up here. And I know that you're going through extensive training right now.
Extensive retraining.
With your wife, and she's just a wonderful lady, and your whole family for allowing you to spend this last year up here and helping us. And Ian has really helped us get to where we are today with being on the recruitment team and helping with us recruit Joe and make sure that Joe's a great fit for us. And Ian is also here for us if we need him and questions and anything. So you really, as far as I've seen, really kind of charted a course for Bartlett Regional Hospital in your direction. So on behalf of all employees, the board of directors, your executive team, and everybody, we got you a little gift, and we just want to thank you so much, Mr. Ward.
Thank you so
Everything
much.
you've done.
Appreciate it. Yes, thank you.
Thank you.
Should we open it now?
Yes.
No.
Something, say something.
I have no idea what this is.
Well,
Oh, wow, it's a pocket watch or
it's
compass?
a compass, because you really helped us chart our course.
I get it.
We really felt that this is something that,
Let's see, how do I?
it's not meant to be open. No.
Did everyone see it?
Oh, that's cool.
No, actually just
No,
got
we've
here a
not
few
seen it.
hours ago.
Only on mine.
Hopefully it should open and have a
There.
special
Ooh.
meeting.
Oh, it does. It says, Ian, thank you for your leadership, Bartlett Regional Hospital. It's beautiful. Let me pass it around, but I will collect it right there.
Thank you very much.
Thanks. I love compasses.
Is there anybody else here for public comment? So before we go on to the meeting, I just want to let everybody know that we had a great ceremony that Aaron, I want to thank you really much, and the whole team of Bartlett for helping put this together. Anita and Chad and the senior leadership team to welcome Joe as he takes over as his new position as the CEO. And I know that most of the board members were able to make it there that were in town, so I appreciate that. So Joe, on behalf of, again, the board of directors, Bartlett employees, your senior leadership team, we have gotten you a little gift welcoming you to us as our new leader. So thank you very much, Joe.
Yes, you did.
Yes, you can.
Yes, I thought that should.
That's where the ball came. Oh, well, that way you knew where you were. Lock up his desk. That's heavy, be careful.
It's not light now.
No. Packaging.
The idea of like.
Years. Oh, okay, I'm
So he'll be leading the crew here at Bartlett. So once again, thank you guys very much. I know we got a light agenda, but we're gonna keep on going, so pass this around. And the consent agenda, we're on the consent agenda. Can you get a move to approve consent agenda? Thank you. Second, and thank you. Old business, Kim. Sorry, you're not feeling well, but can you give us some old business update?
Yeah, thank you, Mr. Chair. Sorry about there in person. I went and watched, went out of town for the weekend and brought back some bacteria. So here's my report for the capacity update. First and foremost, I just want to say, some people may be concerned about the IV fluids. The Baxter plant was affected with the hurricane. We don't have any concerns with that other than smaller bags that we get from Baxter. Most of our IV solutions we do not get from them. We are still monitoring that and being conservative as we can in all situations. But so far, we don't have any area of concern as far as IV fluids. For the capacity update, MHU has patient days of 230 for September, Med-Surg 346, CCU 66, OB 84, the nursery 66. The ED saw a little over 1,000 patients last month. We don't currently have any COVID in-house or any employees out with COVID. And we have a total of 4 patients waiting for either subacute rehab or long-term care. And I'm happy to answer any questions. I'll let Kim Stout give a report on Wildflower Court when she gives her report.
Thank you, Kim. Does anybody have any questions for Kim? All right. Joe, we got a organizational design update. Joe.
Yeah, this is an action item that's kind of been in the works for the last couple of months. So Ian had started to work on this, and he'd worked with Chad, and so as I took this position at the beginning of the month, that kind of reformed it to meet how I work best with my team, I guess. So I kind of lined it out a little bit different than he had it. What I brought back for approval for the board is just the positions that'll be reporting to me at this time. We are still working on some of the minutia under that, and so there will be additional changes to the lower levels of the org chart in the coming months, but we hope to bring back the full organizational chart in December for the board to see. But at this time, we'd like for the board to approve this level of org chart, which is required by CBJ.
Thank you, Joe. So this did not go through a committee. This just came right to the board. So we're open to discussions. It is an action item, so we will take a motion.
It does not require,
Would you require a motion? It's an action item.
it's just a verbal.
Any questions? Hal?
Yeah, I've got 2 questions. As I was preparing for this meeting, I could decode what most of these things were, but COMMS, I think these are the way it was presented is a little too cryptic for the public. I mean, given that, we have the press and so forth trying to interpret what these things are. So in the future, I'd recommend use of some more words, but I don't know that I understand which every one of these are. That's one thing. The other thing other thought I had is that's quite a span, 10 joint direct reports. And I guess you've already thought about that. You wouldn't be suggesting it.
No,
I didn't think it was appropriate, but that was a thought I had.
in my experience at working at smaller hospitals, the CEO typically had somewhere between 9 to 10 direct reports. I mean, the load gets spread a little more evenly for the size of hospital we have. And so that's something Ian had worked with. So it's something I'm used to seeing too.
But could you go through and explain what
Yeah.
it is?
So then we obviously have the CFO, comms and communications, CNO, COO, the CQCO is the chief quality and chief compliance officer. Executive assistant is a leader.
Would you put current names to these positions as we go?
Oh, yeah.
I think we all know who they're, we all know.
So Gail is the CQCO, CNO, COO is Ken, and he is the executive assistant. The hospital is just a group of providers headed by Dr. Tainter. HR is Chad. Information systems was Chris Letterum. We're currently recruiting for that position. Med staff services is Carmi. And specialty clinics is Sarah. Answer your question.
Are you eventually gonna, will we know who then reports to them? We have that breakdown.
Yeah, so we'll have all the tiers laid out after. We're still moving things around and just, it's kind of a process to do all this.
So this is the first part that's required by CBJ to so.
Okay, I was just curious. I figured so, but
Hey Kenny, this is Max.
Hey, Max.
I've just got a couple of questions. So, I guess first, why is this just coming up now? Has this been an issue in the past, or why are they asking for this now, Joe?
So this is something that they brought forward, I thought, the June meeting, when we started talking about the org chart. And that Chad brought forward the required CBJ language and the approval of the board of this. And so this is something that, since we've made the changes to removing the executive director position over the last month, this is something that needs approved by the board. So the timing, I think, has just been working on it over the last 6 months.
Mr. Chair,
Go ahead.
I guess the question is, since I've been on the board, we've made major changes to the org chart. We have not, I don't recall that we have had to. We did with David. Okay.
Again, too, Max, I just want you to know, I questioned this too, why we had to approve this. I thought this was definitely under the CEO's purview. I think last meeting, Chad really kind of explained it to us that we're just kind of setting a course here to make sure that we stay on it and don't keep making changes. Shelley in the last meeting too was really concerned about when it came out. We looked at it for the first time and it was a little bit more in depth the first time, and she was really concerned that we didn't make too rash of changes on there. So I've met with Joe about this. With Hal, I think Hal was in that meeting about that when we were in Joe's office, and he brought this org chart out and showed us that was the last time we looked at it. It was last Wednesday, right? Or the Wednesday before. Correct?
Last Wednesday, but I think it was Deb.
Was it Deb?
Yeah,
Oh, I thought Hal
I
was in.
you showed that to me.
Okay, so we did see.
Kenny,
Go ahead, Max.
Would there, I don't know, it seems, I guess, when I look at this, it seems very flat. It seems like there could be some layers in here that aren't here. It seems like a lot of direct reports for you, Joe. And I'm not comfortable voting on this right now, honestly. And the suggested motion, I really am not comfortable with either. And I'd prefer to refer this back to planning and discuss it a little bit more before unless there's some reason we have to do it now. I mean, I'd like to have another cut at it, I guess.
Max, are you asking to see the whole chart put together? The whole thing? Because, when we had the CEO, like when Gerald was here, he had 17 reports under him, I believe. Isn't that right? Yeah, he had a lot of reports. So
I don't remember the number, but
yeah, I Max, I'm okay to refer this to planning. We got planning meeting coming up November 1st. I'm okay to do that.
I don't want to mess the process up here a little, I guess, but it just seems like, I don't know. Joe, are you comfortable with this?
Yep.
I'm very comfortable with it. I was the one that put it together.
So the motion, I don't understand the motion. The approval of the plan of organization by the board does not need to be by motion. How is that a motion?
I don't understand it either.
It's not,
What's that?
it's not a motion. It was just clarifying that it did not need to be in motion. Sorry.
Chad, can you explain this a little bit more to us?
Yeah, so back in, I want to say it was May, June, we went over the 5 principles that we're trying to build the organizational design upon. Number 1, fiscal responsibility. Number 2, layers of management. The goal from the CEO to the frontline staff was to be no more than 5. Span of control, stated the optimal span of control is between 7 and 12 individuals. And understanding that as a small hospital, we have to wear multiple hats. And then making sure that the decision-making and key stakeholders are in the right places to participate in key meetings. So that was something that we talked to y'all about a while back, and then met, of course, with Ian and during his tenure, and then as Joe transitioned in, we made a few modifications to that to align with Joe's past experience and to align, I think, a little bit with how we're proceeding into a critical access. So the suggested motion, I apologize, that is my fault. I take ownership of that. This verbiage was actually from the last go around with Mr. Keith, and I pulled it straight out from the last packet, but it did state that it does not need to be a motion. CBJ law has advised simply that it just needs to be a verbal, yes, you're good to go and move forward with this. From my understanding, the top level of the organization is what is kind of verbally approved by the board. And then from beneath that, that is up to Joe's purview.
Thank you, Chad. Yeah. Al,
Kenny, if I could then,
I'll
so
go first, Max, and I'll go right back to you. Go ahead, Al.
Joe, could you very briefly tell us what is this a change from?
What are the changes from our current structure to this structure?
Yes, and what are you trying, maybe briefly say what you're trying to achieve?
It's kind of a bouncing of the load and spreading it out a little bit differently, and just some of it's what I'm used to seeing. So the first four on the left, CFO, communications, CNO, CQCO, all report to the CEO today. So does the executive assistant. The hospitalist, that's kind of been undefined. They don't kind of understand where they're or where they fit in the org chart. So that's why we put them here. So they've been bounced back and forth between Ken, the CEO, they've worked with me. So we're just putting that in paper so they know where their direct line is. HR is a change. That's something that reported to Gail in the past. I'm used to that being underneath the CEO. So that's something that I wanted. So that's one of the big changes. IS already existed under the CEO. Med staff services, we had moved back from Gail to the CEO under Ian's tenure. And the specialty clinics, that's something that was under Nate Rumsey. And we had to move it somewhere up with his transitioning of the organization. The other changes, he had a couple other departments that had to get reallocated too. So this was in addition to those departments, kind of reallocated the load amongst all of us.
So if we could ask you a follow-up, so where is Nate?
We eliminated that position.
Works for city now.
Yeah, he works in engineering and public works.
Okay, Max, and then go to Dr. Astor.
I guess I want to focus for the time being on the suggested motion. It's how we capture this discussion in the minutes that I guess want to focus on a little bit. So, and I'd like to hear from Joe about that, but I guess I would like the minutes to read that Joe presented a plan of organization to the board and leave it at that. I mean, if it doesn't need to be approved by us, I don't want us to approve it.
So I think that, and I don't want to speak for Chad and the city folks here, but I think that all Joe really has to do is present this to the board, and the board can verbally support the changes to the leadership structure. And then Joe will come back with Chad with a complete org chart in the near future. Am I correct, Chad?
Yeah, my understanding, yes.
Dr. Astor.
2 thumbs up on that suggestion. I feel comfortable verbally approving for a couple of reasons. It reminds me of the flow chart that Bob Ballard used to have 25 years ago. And Joe helped create it. And there's more to come. We can approve it later again. So I feel comfortable giving higher. Thank you.
Lisa.
To Dr. Astor's point, I agree with him. This makes sense to me. So, I mean, the doctors, I mean, you've got a couple of different groups that are reporting to him, but I don't see how it's appropriate to have any of those groups reporting to somebody else on that list. So it makes sense to me.
Thank you, Lisa. Okay, so Dr. Astor, you want to get us there? You want to give us a verbal approval on this?
Sure. Well, I don't know if you have to take a vote or not, but I'm just going to speak for myself, not the group. I would be happy to give approval and ask any of my litter mates here to join me in approving it as well. Or members of the one.
If there's a motion in a second. So it's not a motion. All it is a verbal support.
But if it were,
All this is a verbal support for the changes to the leadership structure that Joe has presented to us. And that's kind of how I want it to be read into the minutes. And Dr. Astor is asking that for the board's full support. Is there any objections to that? Okay, seeing no objections, we have the verbal support of the board for Joe and Chad to proceed. Okay. Ophthalmology update, Joe.
Ophthalmology update. This was brought up at the last board meeting when I was attending verbally or remotely with Chad and Kim. So over the last month, what we've been able to do was we have directed Sarah to work on securing the locums to come provide this service over the next couple months. So we had an ophthalmologist on site today looking at our space. They're reviewing it, hopefully tonight. And we're anticipating if we can get that contract signed and potentially done over the next week or two, we should be able to host a clinic in the month of November. That's our plan. So if we get that contract signed in the next day or two, we will start posting clinic schedules, getting letters out to all the patients that were affected, getting the communication spread out, and then continue to work on long-term plans for that service.
Did we miss October's clinic?
October was provided by ARC, so that was last week, I believe. Well, that'd be this week. I know it's taking place. We have a clinic scheduled for October right now.
So that's great. So we should have October and November covered.
If everything works out with this, we should have no gaps in service.
Thank you guys for getting this done so quickly. Any questions concerning ophthalmology to Joe? Next. Okay. Moving on, and we'll turn it over to Kim Stout. Now, we were supposed to, these two action items were supposed to come up in a quality meeting, and we didn't actually have a quality meeting. It was canceled. So Kim is going to go through these with us, and hopefully we can get a vote on this. So turn this over to Kim.
See, in your packet, I guess the first one up is the QAPI plan. And we're asking for a motion today for the board to approve Wildflower Court's annual quality assurance performance improvement plan. That's an annual plan that has to come before the board. It did go through the Wildflower Court Quality Assurance Performance Improvement Committee, which is a multidisciplinary team. It includes Dr. Malter, infection control, the director of nursing, and then several other supports that sit in on that committee. The actual QAPI plan, and I went over the background that nursing facilities are required to develop, implement, and maintain an effective QAPI program. And it is, the plan is written and contains the processes that will guide us in our efforts. And then you have a copy of it. I'm asking for your approval today to accept it as it has been presented. If you have any questions about it, I'll entertain any questions that you may have as you read through it.
Great. So I just want to start off by saying that we had done this last year, and we had quite a conversation about this, about that it goes through the quality.
Yes.
Over there at Wildflower Court. I actually believe that Gail had something to talk about it last year too as well. Did you see this plan as well, Gail? I know that you're and you're okay with this. Do you have any questions concerning this that we need to know about this?
Yes, and Deb Kelch sits on the quality improvement plan over at Wildflower Court.
Oh, great. That's good.
So we did have hospital representation on that committee.
Yes, Mr. Chairman, I've reviewed this and I move that we accept it.
Thank you very much. Second, do you have any objections? All right, seeing no objections, this motion passes.
Thank you.
Thank you. Next.
The next one is the annual facility assessment. I've been speaking to you at previous work meetings that the regulations changed a little bit this year on the facility assessment. It was due in on August the 8th. It did go through our QAPI committee for that approval. in August, so it was approved by the Wildflower Court Quabbie Committee prior to August 8th, but I'm bringing it on forward to the board for your review and your approval. The assessment, primarily the changes in it this year were centered around staffing. And so Chad and a lot of individuals from the hospital contributed to this facility assessment, and it even the assessment, the program that we utilizes actually shows everybody that contributed to it, and I hope that you had the chance to read it. So today I'm asking for the board to approve our facility annual assessment, and I'll entertain any questions you may have related to this as well.
Yes, Mr. Chairman, I want to ask, when we approve this subject to minor editorial revision. So when I looked through this, I had a hard time understanding the tables. Let me get this back in front. So when we look, for example, at the first table, it's not listed as table one, the first table, we have these numbers which are admissions divided by stays. And then we have percent of admissions divided by stays. I mean, just using arithmetic, those should be the same numbers, differing only by the number 100. But it's not obvious at all to me what these things are. And so I would ask that you put in the table somehow what these things are. Or further defined, maybe the table headings need some more words so that the reader can figure that out. And then later in some of these tables, you get down to it was so baffling to me. So under something here, I think it's acuity, disease, and conditions. This table is not named either, table 3 or something like I would expect. We have something like cancer evaluated. It's not obvious to me what that means, so I'd ask that you make some minor editorial changes, use some words to describe what that means in the table. Does that make any sense?
It does. To help you clarify a little bit of this data is pulled from our MDS data that is uploaded to the government. And a lot of the information that is coming out is their verbiage and their outcomes. So I'm not able to change some of it because it is their data. And it auto uploads into this program for us.
So there's no way to put some text in there to explain those tables?
Not into the headings and into the actual categories. I cannot edit them. What I can edit is the verbiage that comes, my assessment underneath each of these tables, because that's where you'll see where I begin utilizing this data to determine the outcomes of our assessment. You know, like what are our highest diagnoses? What do we have the highest number of related to pulmonary? We have a real low incidence of residents coming in or that we're caring for that has asthma, COPD, or chronic lung disease. However, we have a high rate of respiratory failure. We only have 4. But 4, based on our volume, puts us at a high rate. And otherwise, I'm not able to change the tables, but I can change the way that I am measuring that below and documenting what I am assessing from those numbers. Does that help a little bit?
Yes. So I was, now that you understand what I don't understand, I'd be happy to just approve this and give it to you. Figure out how to make it better.
This assessment will help guide back and forth each of these. The assessment gives me the data I need to focus on from a quality improvement perspective, but the quality outcome data tells me if I need to make it a priority on my assessment as well. It's kind of a circle.
Perfect. So it looks like we're just looking for a little bit more clarity in the narrative.
That you're looking for a second, sorry.
They're looking for a second.
So, yeah.
The government needs someone like Cal writing the programs.
Okay, so we got an action item. It's First and second, do we have any more discussion on this? Seeing no discussion, seeing no objections. Thank you very much, Kim.
Well, Mr. Chairman, I understand that Kim has thought about moving to greener pastures, and I just want to take a moment to say how grateful I am for all that you did to set up Wildflower Court for the hospital, and especially how personally grateful I am for all the hard work you put in on hospice and home care.
Thank you. I have
It's just-
enjoyed it.
It's been a huge accomplishment.
Thank you. I have enjoyed it. It's been good to be here. I appreciate it.
Mr. Chair.
Yes.
I just want to add that this has been a heavy lift. We know that a long time coming, and the heavy lift is in an area that not many people in this organization had any experience with, so we're so grateful for your guidance and getting us to where we are today.
Thank you. I enjoyed it, and hopefully they're ready to move forward with success. I hope I leave it that way.
Yeah, this was a huge project. I was the DON at Wildflower Court 10 years ago, for 2.5 years, the quality report thing, that is a big deal, and it's very challenging, and the work being a nursing home administrator and a DON is very challenging. The regulatory environment is unbelievable.
Yes.
And you've done a wonderful job.
Thank you.
Thank you.
Thank you.
Yeah, Kenny, I just want to echo that too. Kim, thank you for your hard work. We appreciate it. It's been turbulent time and you've been a voice of stability. So thank you.
Thank you. I appreciate the kind words.
And you stepping in here and getting your license and everything at Alaska is just, it's great. And your willingness to stay and make sure that it does succeed is very much makes us all feel glad that you were here and are going to be here until we're here for.
I'm just a phone call away. That's the way I look at it. You know, Teams is great, so, yeah.
Kim, I'm not sure where you're going, but are the accents more like yours where they are?
Absolutely, they sure are. I'm heading back to Oklahoma.
There you go. Good.
I thought you're from New York.
I'm really close to Arkansas.
All right, thank you. So next up on the agenda is a med staff report. Our chief of staff is not here today. I talked with Joe, and Joe said it's okay if we just move this forward to next month. So we'll have 2 months of a report next month in November. Committee updates. I'm going to turn this right over to Hal with the compliance committee. Now,
Yes, no, thank you, Mr. Chairman. The minutes pretty well reflect what we talked about. I just wanted to point out, though, that the most interesting thing to me was the Joint Commission report, and that was very interesting. I got a copy of the I don't know what it was. It's in the report. Is it?
It is.
It's okay.
Citations.
The citations. The problems range from things like gouges in a door, or a watermark in a ceiling tile at one end of it. And then maybe there's some problems with documentation kind of in the middle there, to a couple of fairly serious problems like inoperative smoke detectors. And my understanding is some of those things were just fixed immediately. And my understanding from staff was that overall we got a good report from the Joint Commission. But because this is so important, I'd encourage anyone who hasn't done it to take a look at this yourself. And anyway, like I say, everything else is in the minutes. Thank you.
thank you, Hal. Does anybody have any questions for Hal? Thank you. Okay, next we will go to Max. We weren't able to get the minutes in there for this report, so Max is going to give us a
Yeah,
report.
the minutes are not there, but it was a quick, easy meeting. You do have the substance of what we talked about, which are the financial statements and the consent agenda. And page 10 is really probably the focus area. I would say we had another strong bottom line in August. We're now about $3.5 million in bottom line. But most importantly, on operations, we're year to date at 2.9 million bottom line. And that compares to last year's bottom line of a minus 2.3 million in operations. So we're about $5 million ahead of where we were last year. So I'm sure Joe would tell you that we're going to have a cold winter at some point, but it's nice to have a little bit of a cushion going into that. So, you know, we've had positive results for a couple of months now. So that's good to hear.
Thank you, Max. Anybody have any questions for Max? No questions? All right, we are moving right along here. Let's to make a reading. With that, we'll go right on to our CEO report. Joe?
So for my CEO report, it's gonna be, I'm gonna take my own kind of view of this, so. A continuation of some of the things that Ian had worked on. I have done a CEO letter, it's in your packet. So what I'm trying to do is project some of the stuff we're gonna focus on over the next 30 days as we start work on some of our more current problems. Some of those are the lean methodology. We are going through an A3 meeting here the first part of November, and so we're reviewing all the departmental A3s at that meeting. Getting updates on those. We're also we have Cliff Hogan on site, and he's doing some one-on-one training with the A3 process. So he comes in, assesses where we kind of left off or dropped off in some of the areas to make sure that we're up to snuff on how we're doing our lean methodologies. I also talked extensively about the critical access process. We touched base on this at the finance committee. We have had meetings with the Department of Health a couple weeks ago. They went through our variance application, asked several questions on that application. We have some work to do in getting some responses submitted to them. We're working on an application. We're looking at our license application, what that could look like with critical access, and we're also looking at community health needs assessment. So during the meeting, there was lots of tough questions around why are we making this leap? What's the financial stability of the organization? Are we looking at cutting additional services? So we went through the Department of Health's questions, answered them. I think we were in a good place when we ended the meeting. They felt comfortable. I think we felt comfortable. And so we're moving forward with the critical access application at this point. They haven't responded, so we're still waiting on them, and the ball's still in their court. But we are doing work on the backside. We're currently working through our cost report, and so we're looking at that through the critical access lens, or what we have to change for some of our allocation methodologies. Once we make this step, all those lead into kind of our core sustainability. Now, that's based on the good financials we started the year with. We need to continue to focus on our processes. We've been very diligent over the last 9 months. We can't slack up, so we need to keep these things at the forefront, continue to improve on some of the stuff, some of the changes we've made. You also have in the packet annual community report that Aaron put together. So this goes over some of our accomplishments that we've made over the last year. So while it has been a challenging year, I think we do have a lot of things that we have to celebrate at this point. We have a lot of wins. We've done a lot of good community care over the last year, and so she's done a great job kind of encapsulating that in a document that puts it together for the community. We also have updated mobile crisis care. Kim's done a lot of work with the CBJ on getting this spun up, so she's worked with the fire department and mobile integrated health, working with them. So when our staff are on board, we're able to do ride-alongs with them and come up with trains. So when we step this up to November, our staff start training and ready to integrate with their staff on the mobile crisis side. The last one I have here was this will be Kim Stack's last board meeting. Now I want to say my thanks and appreciation for all the hard work you've done as well.
Any questions for Joe?
The mobile crisis, there's been talk about that for a while. It sounds like a wonderful program, but again, are we going to run into funding issues like we did with psychiatric services that are generally not well funded?
Yes, and that's not well. And so this is one of those programs that kind of keeps the people in crisis out of the ER, or helps put them into the right care environment, I guess, when they're in crisis versus just showing up to the ER. So if we didn't have this program prior, and these individuals just showed up in the cognitive or non-emergent care. So they need to be stabilized from a mental health standpoint. So There's not a good funding mechanism for this in place at this point. But when we went through, when we did our core and non-core, this was one of the ones that was kind of deemed core at that point. We have had discussions with Becky Edberg at the state of Alaska on how they're gonna look at funding crisis care in the future. I know they are adding more and more of these services to their waiver programs to make it available. So we'll continue to work with them on that standpoint. I probably didn't answer your question. It's got to talk about what I did there.
Well, it sounds like the funding source is not completely elucidated, and other places like Anchorage has struggled a little bit with their funding for this exact program. It's a great program. The number one deliverer of healthcare, psychiatric care in the United States is the prison system. And that's not what they want. And so it's a great idea. It's just funding, which has not been good in the past. So just so long as we keep an eye on that.
And I really say that, when we met with the state, with the OH Department of Health, they really emphasized to us how important that we keep a footprint in mental health. And I think that was one of their main concerns on us, what was core and what wasn't core. So I believe that they would really want to see this succeed for us. So I can't say that they're going to give us funding. I can't say that they're going to give us funding, but this is something that I think is really important to the state, and it's going to help us achieve our other goals. Joe.
One more comment. When we do get to critical access, since these are licensed, they're not LCSWs, they're LMSWs. That's not a billable service under Medicare. So they get lumped into the cost-based reimbursement model once we get to that point, if that makes sense. And so there will be reimbursement from that perspective at some point in the future.
Perfect. Anybody else have any other questions on Joe's report? Right. We'll go right back to Kim. So it's your last meeting?
Yes,
When are you leaving town?
next Wednesday.
It's Wednesday.
Today will be Tuesday the 29th here. So my report, and the good news on the report is related to the fact that Wildflower Court is up for a bronze award. I hope you got to read that. That is based on our short stay measures, just our subacute rehab residents that come in. We are a 5-star facility on our short stay measures, and it has helped us to qualify for a bronze award with the American Healthcare Association. I completed the intent to apply and have begun the process of completing that application, which is due January 23rd of 25. Gail is involved in that with me, and as are several others. We met last week to kind of walk through it. And I have every intent on getting that bronze award, and hopefully next year they can get a silver award and keep working toward the gold. So that's the positive news on Wildflower Court. The other is related to, you'll see on our average daily census, we are continuing to grow that census. It has steadily increased since June. September was the highest number of an average daily census that we maintained for 15 months, for the past 15 months. And October is going to stay right around that 52, 53 number. As of today, we have 50 residents. We've had some deaths in the past week, but we have 3 admissions coming in this week as well. So we'll be back up to 53 by Thursday, I think it is. Also, as we look at our, I didn't have the September numbers yet to plug in on our expense on our travelers, but I do know that for the month of October, our traveler number has went down to 12 or 13. 12, that's what I thought, 12. So we have been able, you'll see our highest was in October on our number of travelers, which we had 26, and we are down to 12 for the month of October thus far. So we have continued to steadily decrease our travelers. The bulk of those are licensed nurses. And then we still have 5 5, 6, maybe CNAs that will probably carry through for the period. However, the next class should get us staffed up to where we can maintain safe staffing with this census of around 53, 54. So as far as home health is concerned and hospice, we have 24 on home health today. And we have 2 pending admissions for our home health line. We, whenever I typed this report up on the 21st of October, I'm thinking that we had 5 on hospice, maybe. And we are down to 2 today due to 3 deaths that has occurred since that date. And our average length of stay has been 69 on our hospice. So we just need referrals and we need admissions to hospice. We're keeping the length of stay up, but it's where we're at. Any questions?
Any questions for Kim? I had an opportunity this month to have coffee with Dr. Peterson before he left town, and he's just so excited about the program of education and getting that to the public, and he's going to be on the radio, and he's really going to be just a great advocate for hospice. So it was really a great meeting with him. So I appreciate that. Dr. West.
And then just a couple comments. Sounds like the Brown Star is going to move forward with that award, and it would be really nice if you could get together there and just to sort of put that out there in a newsletter or something. All of us helps. And then if you don't have a twin sister, if you are you going to help with finding someone as capable as you?
Yes, absolutely.
Any other questions, comments? Thank you, Kim. Enjoy Oklahoma.
I do enjoy Oklahoma.
Moving right along here, Wade is not here as the assembly is reorganizing tonight, so we will find out who the assembly liaison is. My president's report is kind of short. I did get, like I said, to meet with Dr. Peterson this month to talk about home health and hospice and what's going on in that world, and he's very great and very excited about it. I did get an opportunity to meet with Joe for my first CEO meeting, and Hal was with me, so it was really good. Spent some time there, and when we were able to go to DOH, the Department of Health, Joe was there along with Kim, and Max was there, and Ian was there, and Joe did a great job really explaining Bartlett's position, and Kim did just a really great job explaining clinical needs, and Max actually was able to give some great history on Bartlett and where we're at. So I just want to thank our whole team for working so hard to get us there, and they came out asking some really hard questions of us and really wanted to know what was going on with Bartlett, and we were able to really explain it to them. So thank you guys for that. I appreciate it. It was a good month. We didn't have a lot of meetings. We're gonna move forward next month and probably get some more committee meetings going. I want you guys to know that towards the middle of the month, Dr. Jones had sent me his resignation. So Dr. Jones has resigned from our board officially. And I spoke with CBJ, and again, the assembly, they appoint him, and I've talked to them, and we'll probably be picking up new board members right along when we were supposed to. So we're at 7 right now. So it's important that we all try to make these meetings, even if we're virtual and stuff like that, to make sure that we have a quorum and we still keep working together. That's all from my report. Basically, do you guys have any questions for me? I was really hoping Chad was gonna go to a Dodger game. Really disappointed, but that's, we'll pop up the board calendar. Deb,
Yes, I'm just conferring with my short-term planning committee liaison here. We'd like to keep that on the calendar.
okay.
We haven't met for a couple of months. So
Perfect. And then will you be able, I'll be out of town, will you be able to do credentialing?
I can.
I can't see that far away, so what is,
Finance is on the 15th.
finance, Max, are you okay with that? Perfect,
Governance on the 21st at 3:30.
and that's Lisa chose that, you're good with that, right? Your whole committee is there. Perfect, and then what else you got?
Board of Directors is the 26th.
That's Tuesday, so we're a couple days before Thanksgiving, so.
Are we just gonna have a quality meeting after the new board is seated?
That's a good question. I was asked to be the chairman of the quality. I haven't been on quality, but I've headed the quality committee at Barton Hospital.
Congratulations.
For a little while. I've been on the committee. For
Yeah.
so, but so I'm happy to run that committee, and it's just a matter of finding out who's on the committee and when I'm on planning and house committee. So, and
I will help you out. I can, if you can't go to some of those meetings, I can go in your spot too.
okay, in terms of, so I'm happy to get together with Gail. She and I have been discussing agendas, and I'm happy to get that committee for a meeting in November. Who else is on that?
So the quality meeting with Shelley and Lisa, so.
So we'll just get together then and try and have a committee. I'm not a complete committee novice, a quality novice. So we'll try and arrange one.
Perfect.
You don't plan on having another quality committee meeting at the end of the year, do you?
We'll probably have one in December, but
What's that?
I think we're probably.
December.
December. All right, so I think we're good there. Thank you very much. Time for board comments and questions. Any comments or questions from the board? Awesome. All right, so it's 6:30. We're going to take a very short 5-minute break, and then we're going to come back and go into executive session. So we'll come back at 6:35. Now, Dr. Rastor, can you take us into executive session?
Sure. I move the Board of Directors of Barton Hospital recess into executive session to discuss several matters, those which by law, municipal charter or ordinance are required to be confidential or involve consideration of records that are not subject to public disclosure, specifically the convention report, med staff meeting minutes, patient safety dashboard, legal updates, union negotiations, etc.
Second.
Thank you. Seeing no objections, we are in executive session, so everybody that's not supposed to be in executive session, we'll be putting you in the waiting room. While he's doing that, it's just a reminder, if you are on a Zoom, make sure you're in a quiet, confidential area where no one can hear you talk or hear us talk.
Yeah, I'm gonna put you in the waiting room.
Yes, you can put me in a bigger room.
With that, Al,
Choose which staff to retain.
Shelley, seeing no objections. Anita staying here. All right, see the recordings back on too. That help.
Mr. Chairman, for the minutes, I'd like to note that we received guidance on the union negotiation. We accepted the current credentialing.
So motion to accept the current credentialing report as is. Do we have a second? Second, Shelley. Seeing no objection. Station reports accepted. With that, we have come to the end of our meeting. It is 6:58. My record fastest meeting, and we are officially adjourned.
Max, I know it's late, but have a good night.
Thanks, guys.
Thanks, Matt.